There's some crises that we need to deal with. Another health crisis is looming as one of the two radiotherapy machines for cancer treatment at the Kolebu Teaching Hospital has broken down, leaving scores of patients stranded. Now, on Thursday, July 4, 2024, patients who arrived for their scheduled treatments were turned away as oncologists worked frantically to bring in engineers to repair the machine. Men, women, and children, some of whom have traveled from different parts of the country for treatment, now find themselves without life-saving care they desperately need. A breast cancer patient referred from the University of Ghana Medical Center is one of the many patients left in the limbo.
On the type of cancer that I had, I am not supposed to delay in treatment. If the invasive type, and I was scheduled for radiation treatment, which will take 16 working days. But I realized that they were having issues with their machine. It keeps breaking down. Anytime I go, I was scheduled last week, Thursday. I did a Thursday and Friday, and I'm supposed to continue from Monday up to date. After those two treatments that I had, I've never had any. So when we calculate 7 days, I had 2 days out of the 7 days, which is so giving me so much stress. I'm here today not talking for myself alone, but there are a lot of women out there in Kolebu, children, men, that are having the same issue. The whole Ghana currently, only 2 machines that is supposed to be working in Kolebu. The one that I am using has broken down. The one that is working now is the old type that is less effective. As in, when I said less effective, meaning that it comes with other complications, more complications. But the one that I am supposed to be using has less complications and is much effective, and that is what is broken down. Now, my case here is that not only me, there are a lot of people out there that are waiting to be treated. And realizing that, you know, that it's not the ailment itself that is killing, but the system. When you ask, they said there are some engineers that have to come and work. I don't have any problem with that. So why can't Kolebu have their own engineers? Maybe if there should be any problem, they can fix it there and there. But here, when the machine breaks down, they have to call the engineer, and we have to wait for a very long time, and then it will not even work anyway. And then we have to go back. And it's so expensive when we are using transport as well. So I'm here this afternoon, pleading. I'm just coming all the way from Kolebu. I've not yet gotten home yet. I'm pleading with the one responsible to provide the requisite machinery that we need in Ghana to save lives. It's lives that I'm talking about here.
Now, joining us via Zoom is Professor Joel Yani, who is the head of Oncology Department, Kolebu Teaching Hospital. Prof, good afternoon, welcome to the Pulse. What can you tell us about this machine, and is there plans underway to have it, work?
Okay. Thank you for involving us in the discussion. I can readily identify with complaints of the patient, because at the beginning of treatment, we do counseling, and we tell all patients that because of tumor biology, it's important to be very compliant and to adhere to instructions of the doctor, and that is to have the treatment on schedule from Monday to Friday, weekends without treatment, and they should try as much as possible not to break treatment. So when we give them such advice, and for some reason we have to break that protocol in order to repair machines, then it becomes worry for ourselves as well as. So I can readily identify with patients. But I want to assure patients that issues, we have situations which I'm about to explain. So breaking down of radiotherapy machines is not strange. Happens all the time, even in the most advanced of countries. But for those countries, a given center may have several machines on site, so that when one is not working, you move the patients to the other with no interruption in treatment. But in our case, we have only one site on site, and that brings problems because it means we have to repair that machine before they can resume.
Right.
We have the machine it's fairly new. It's fairly new, and I think that it's been working well. It's only that the past 1 month has been a little bit erratic. We have maintenance agreements with the vendors, and they have engineers here in Accra. So whenever there's a problem, it's just a matter of placing a call, then they come over and repair it. You have to make the diagnosis first. The problem only arises when there's a diagnostic delay or you have to order parts from abroad, then it will come through DHL. That will take a little bit. As I speak, the engineers are site. Our machine is a bit overloaded now because normally you should take at least between 30 and 40 patients. But now we are treating over 60 patients daily.
So there's pressure on it?
Yes, there's a lot of pressure on it. Probably due to patients coming from Kumasi, those who should have been treated at Kopanochi Hospital, because their machine has not been working for close to a year.
Yes.
Now, yes, as those patients who can afford it, have relatives in Accra, will usually come to Accra and be treated. So that places a lot of load on us.
But what's the assurance here, Prof, that this machine, when is there timelines to say that it will be up and running this day, next week, so that perhaps they can have
all that I can say, I can't tell. All that I can say is that our engineers are on site. They are on it now as I speak. We've been working on it since morning. So I hope they will be able to identify the problem, and then the part will be readily available.
But again,
if the part is not available, then it has to be ordered.
Okay. So their fear is that because of the days that they've missed, their life may be in danger. How do you speak to such individuals who fear for the missed days could land them in more, dangerous situations?
Yeah, so I began with an introductory statement explaining that I understand what we are dealing with. There are ways, there are mechanisms available to us to adjust the treatment to compensate for the missed days. Ideally, it shouldn't happen, but if it does happen, there are ways correcting it. But the wider the gap, the more difficult it becomes to compensate. But we are doing all that.
Right. It looks to me
that the most important thing for us is to have more machines.
Exactly.
In the past, cancer wasn't much of a problem, but things have changed. There's a plan. There's a plan to establish more radiotherapy centers in the country. One in Tamale, who as additional centers, and then even within Kumasi and Accra, there's a plan to have at least 2. So, in other words, we have 1 more each. If that is done, we won't have that problem.
But you've basically answered the question I was going to ask. That perhaps for me, I think that we need to have more investment in the health sector, especially in a teaching hospital, because it appears you are taking on so much loads that stretches the facilities to its limit.
Yeah. And managing these centers was very difficult For instance, the maintenance agreement that we have, it's in foreign exchange. It's in dollars. It's about $180,000 per annum that we have to pay. And you see, it means we have to pass it on to patient. And it makes running of these institutions very under our current circumstances. But we do as much as we
Okay. All right.
keep the machine uptime as high as possible.
Sure. Prof, thank you so much for your time spent with us this afternoon on the Pulse. Professor Joel Yane is head of the oncology department at the Kolebu Teaching Hospital. And the assurance is that they are working to, bring the therapy machine back to work.